All right, how you guys doing? Good. Get this started. I'd like to thank James from Schemo Co. for hosting this. This is awesome. It was pretty out of the blue where I just texted him cold text from his website email. I was like, hey, you want to put this on? And he jumped on the opportunity, so I'm pretty excited. My name's Michael. I'm a National Registered Paramedic. I'm also the founder of Mountain Medical Academy, and I'm going to present to you guys just a presentation about basic first aid for avalanche victims. So today we're going to be talking about how to recognize the common causes of death of avalanche victims. We're going to understand what's called the avalanche victim algorithm, which is a simple algorithm that was developed to help people decide how to treat avalanche victims. And then we're going to learn some common life threats and first aid strategies, or first aid strategies for some common life threats. The outline will be, again, causes of death for avalanche victims. We're going to learn some prevention strategies. We're going to learn again the avalanche victim algorithm, talk a little bit about documentation, first aid, and then we're going to go into it. So there are two types of avalanche burials. There is a partial burial, and there is a critical, or what's called a complete burial. A critical burial, a partial burial is if your head and torso is buried above the snow, or you're above the snow after the avalanche. A critical burial is if your head or torso is buried below the snow. Your chances of survival of partial burial is approximately 95% worldwide. Your chances of survival of a critical burial is about 50%. It's a coin toss. You all hear me? The most important factor for survival of an avalanche is the burial time, the amount of time that you're actually buried critically in the snow. If you're buried 0 to 20 minutes, asphyxiation and trauma is the leading causes of death. If you're buried for longer than 60 minutes, hypothermia becomes a greater factor in your death. Causes of death for critical burials. 75% of avalanche victims die by asphyxiation. They don't get enough oxygen. In this case, for avalanche victims, they define asphyxiation as the insufficient oxygen supply to the body arising from rebreathing the expired air, the air you're breathing out, which is often worsened by ice mass formation, or it's the physical blockage of the airway. Here's a picture of the upper airway that you can take like my head and like slice it in half. This is what you would see. Your eyeball would be up here. This is your nasal passage, your tongue. This is your trachea, the windpipe, and then behind it is your esophagus. The three types of, the three ways that you're going to asphyxiate in an avalanche. The first and most important, the most common, is oxygen deprivation. When you're breathing, just here, having a good time breathing, the amount of oxygen that's in the air is 21%. And that's whether you're at sea level or at Mount Everest. You're always at 21%. The only difference is as you get in altitude, the amount of oxygen, or the oxygen molecules just get farther apart. But you're still at 21% volume. And when you breathe in normal air, you're getting about 0.05% CO2. When you exhale 16% oxygen, and you exhale 5% carbon dioxide. So actually the concentration of carbon dioxide goes up quite a bit. Now when you're buried under the snow, the air doesn't diffuse very well in the snow, meaning that air can't really pass between where you are and the atmosphere very well. So what happens is that as you breathe out, the concentration of carbon dioxide will increase near your airway, but it'll start to decrease, and the amount of oxygen will decrease. And so you're starting to rebreathe, and you'll start to become hypoxic, meaning your body will start to go in a period of oxygen deprivation, and you'll be into a period of hypercapnia, it's called, where your body will actually have too much CO2. And that can start to cause really big problems.
Hey, Michael, do you mind speaking into the microphone
Yeah.
so we can overpower this dance studio?
And would you mind dancing?
Yeah.
All right. Is that better?
Yeah.
All right. So the larger the pocket of air that's surrounding you, the higher the chance of survival you're going to have if you're critically buried. Unfortunately, a lot of times when you get buried, everything kind of just packs in you. People that survive avalanches, they get kind of, rescued. They say snow just goes everywhere, and it's really hard to, you can't even move. This always occurs after burial. The second way that you can asphyxiate is a blockage of the upper airway. And so this is the upper airway. What can happen is that if you're being chundered through this snow, through this avalanche, snow is just going to go everywhere. It's going to go in your mouth, your nose, your ears, underneath all of your ski jackets, all of your parkas and everything. And you can actually have a physical blockage of that airway. Once you get all this stuff blocked, and you get your trachea blocked, it's like being choked. It occurs during and after an avalanche. The last way that you can asphyxiate in an avalanche is by ice mask formation. When I breathe out water vapor. That's why you can actually see your breath in the winter. That water vapor will actually condense on the snow in front of you, causing an ice mask and actually be a physical blockage of your face and a physical blockage that you can't breathe through. And that always occurs after burial. Trauma victims, 25% of all avalanche victims die by trauma worldwide. It's usually of the head, neck, torso, spine, and it happens to both buried and unburied victims, partial burials, critical burials. Trauma is a big factor. It's usually a factor within the first 20 minutes of a burial or quicker. The nasty thing about trauma is trauma to the head and chest can actually make you breathe in abnormal or irregular patterns, and it can actually exacerbate the asphyxiation problem. So if you have a major trauma to your head or your chest, you can actually, it's kind of a debate whether the medical examiner says you die by trauma or by asphyxiation because it happens kind of simultaneously. Hypothermia really isn't a big problem with avalanche victims. About less than 1% of all victims of avalanche actually die of hypothermia. There's a lot of reasons for that. Snow is a really good insulator for about the first 30 to 40 minutes. But also, what usually happens is, you're underneath the snow and you'll probably die by a trauma or by asphyxiation long before hypothermia can take you. It is a huge concern after a rescue. It can complicate, you can have actually complications of hypothermia can exacerbate asphyxiation and or trauma. So if you have a trauma, say you get an avalanche, you get a major trauma, and they bring you up and you survived, thankfully, you can actually have a lot of problems due to hypothermia. So a lot of the times it's a good idea to get your avalanche victim warmed up as soon as possible once you rescue them. Burial depth is a big issue, but it's not as big of an issue as burial time. The depth of the burial is actually it's a factor. There's a very few victims have actually been have been found alive below 8 feet. So if you're 8 feet or below, it's not a very good sign, hopefully. So that's why they worry about terrain traps when we talk about like avalanche prevention, to watch for those terrain traps, because those terrain traps can actually cause a lot of snow to get buried on top of you. Deep burials actually require quite a bit of time to get somebody out and to find them. So the deeper you're buried, the longer it is for you to get a transceiver signal on the victim, and it's going to take a lot longer to probe for that victim. And it's going to take a lot longer to physically unbury to perform that companion rescue. So burial depth is a factor, but it's more of a factor because of the amount of time it can take once you're buried super deep. And again, burial time is still the most important factor in surviving an avalanche. So prevention strategies. How do you prevent an avalanche, right? I think I'm big on prevention in a lot of things. So carrying the right rescue equipment is probably one of the most important things you can do. Make sure you have an avalanche transceiver. Make sure the batteries are fresh. Make sure it works. Perform those transceiver checks. Bring a shovel. Bring a probe. And it's really important to know how to use these things. If you've taken an ARI class or any sort of the Backcountry 101 classes, and it's been a while, it's probably a good idea to just go out and practice the use of these things. Because these are, you don't really use this skill very often, but when you need it, you need to know how to use it. Helmets are a really good idea. You should definitely wear a helmet. A lot of people don't wear a helmet, but it can actually prevent a lot of head injuries. Head injuries can really affect your survival. A ski helmet is definitely preferable to a rock climbing helmet. A lot of people carry rock climbing helmets, like these pencil helmets and these black diamond helmets are awesome. They're super lightweight, but they're not made for they're not intended for skiing. They don't have a lot of, although I was told this new Sirocco is sort of intended for it. But really, ski helmet or climbing helmets are made for a drop of an object from a height right on the top to prevent injury that way. Now, there are some dual certified helmets, like this one. Who makes this? Scott. This is a dual certified climbing helmet and ski helmet. Any helmet's better than no helmet, right? So if you're going to be like, I don't want to carry my ski helmet that I carry to the resort, I'm just not going to have one. You should probably, a climbing helmet's probably preferable to nothing. But a helmet can prevent a lot of injuries. So if you're not skiing in the backcountry with a helmet, I would highly suggest it. Avalanche airbags are kind of the new sexy thing, and they are awesome. There's a lot of literature now that says that they do save lives. They can help prevent avalanche deaths by preventing the burial in the first place. So you rip the avalanche ripcord on the bag or however it works, and the idea is that you float to the top of any sort of avalanche that will come. And they actually do work. They can also create an airspace around the head for those models that deflate if you get under snow. There's a recent paper that came out last year that actually studied this. They buried somebody at Alta with the amount of volume that a typical ski bag would have. They hooked them up to all sorts of sensors to see how they were doing. And after an hour, they pulled them up and they had plenty of oxygen. Their oxygenation didn't go down at all within that hour. So, and then that was sort of the end of the test, was an hour. But they do work. They also anecdotally will prevent head trauma and neck trauma. A lot of these avalanche airbags usually inflate above and around your head. So hopefully the idea is that maybe you won't smack the back of your head against something as easily. But I haven't really seen any papers come out that I've actually studied that, so that's pretty anecdotal. The big thing is that you check your equipment before you go out. The reason that avalanche airbags cannot be effective is that they aren't turned on before they go into an avalanche terrain. The battery is dead, or the canister is inserted improperly, or the canister itself, if you have a CO2 canister, that they're actually depleted. So I think of one study I read, something like 25% of the fatalities where somebody was wearing an airbag, the airbag wasn't deployed at all. And then when they investigated it, there was a myriad of problems like the ones I just mentioned. So it's a good idea to always check your equipment before you go out for the day. So let's talk about the avalanche victim algorithm a little bit and some first response strategies. So really it's up to you. It's up to you and your companion. If you're in an avalanche, it's really up to your companion to get you out. A search and rescue response or a response by Wasatch Backcountry Rescue or a life flight or airmen, it's going to take a while, right? So, and it's going to take a lot longer than that 20-minute window that you have before you or your companion may asphyxiate. So really, it's up to you and your partners. The first most important thing to think about is scene safety. here's a little scene safety triangle we use in the EMS world. The top is you, followed by your fellow rescuer. And then you can start to think about the victim himself, him or herself. You and your fellow rescuer, your guys' safety is the most important. The victim is already in the snow, and they already have a problem, right? But if you go out and you go for a rescue and you get injured doing that, you've actually created a bigger problem than there was before. So you want to make sure that you check and mitigate all hazards before you just jump in. A lot of times it's a good idea to, if you see your friend go down in an avalanche, you do the tracking to see where maybe they are if they stopped. And then take a beat. Like, take a big deep breath. You're going to be excited. You're going to maybe check to see if there's any additional avalanche danger. You want to check to see if there's any dangerous weather around you. You want to check to see if you're exhausted or your partner's exhausted. You're starting to get frostbite or hypothermia if you've been out for a while. Just the big thing is don't become another victim. Don't become another victim. It just makes things a lot worse. So this is the avalanche victim algorithm. It's separated into less than 60 minutes and greater than 60 minutes. And then from there, it's separated into whether the victim has signs of life or they don't have signs of life. There are a lot of avalanche victim algorithms out there. Some are more complicated than others. This was actually made by a team of doctors out of Jackson Hole because they wanted to think of a really easy way to remember how to help the victim of an avalanche, a complete avalanche burial. I'd like to actually thank the 3 doctors because they totally allowed me to use this. Dr. AJ Wheeler, who's a doctor, he's out of Jackson. He does a lot of search and rescue stuff up there. Same with Dr. Will Smith. And then Dr. McIntosh here is in the University of Utah. And then Backcountry Zero. So let's just go through this here real quick. So let's talk about first a victim that's been buried less than 60 minutes with signs of life. So we're going to be in that upper right or upper left to you guys box. So you go in, they have signs of life. So you're going to actually check for signs of life. And A, B, C, D, E. A stands for airway. Do they have an open airway? Is anything obstructing it? Those are the first thing that you're going to want to check when you get to the victim. The second thing is you want to check to see if they're breathing. Circulation. Do they have a pulse? Are they bleeding uncontrollably? Disability. D stands for disability, meaning do they have a head or neck injury? And exposure. Exposure, are they going to be hypothermic? Or are they in danger of becoming hypothermic? So the first thing you want to do when you get to a victim and you start to do a companion rescue is you want to find and uncover their head as soon as possible. That's the most important thing. So if you're starting to do your victim, your companion rescue, and you get to their leg or their chest or torso, try to get to their airway and open up that airway before anything else, as illustrated in this picture. At the same time, you can check, is the victim conscious? Are they able to answer questions? Are they confused? You can check to see if the airway is open. Is there an ice mask? Is there anything blocking the airway? It's a good idea if you can open up the mouth and see if there's any snow or any debris in there and get that out as soon as possible. Breathing. One thing you want to do is you want to think about in a victim of avalanches that they might have a head or neck or spine injury. And so one simple way to open up the jaw, and there's another slide that I'll show, this is the jaw thrust. That'll open up the jaw and get rid of the tongue, which is usually the thing that actually blocks the airway most often, while protecting the C-spine. But you want to look for signs of breathing. So in this picture, this is actually a really good picture from the CPR course. This guy is doing 3 things to check for breathing. The first thing he's doing is he is listening with his ear to see if he can hear breath sounds. What else he's doing here is you can actually feel somebody breathing against your ear. So especially in the cold, they have hot breath, and hopefully they can feel that against their their ear or their cheek. He's also feeling for signs of breathing. If you haven't covered the victim's chest, put your hand on the chest and see if you can't feel any chest rise or fall. Circulation, pulse. Who knows how to check a pulse? Pretty much everybody, like maybe on the radial, right? So most people, you can check your radial pulse right here. It's right on your thumb. But the better way to do it is to check the pulse right here on your neck, if you can. If you can't, you can try it yourself. It takes a lot less blood pressure to create a pulse right here on your neck than it does right here on your hand, especially if you're cold. So it's going to be under the angle of the jaw, and it's going to be on the either side of your windpipe here. And then I always use 3 fingers. This picture has 2, and you want to use light pressure. And the most important thing is you want to check for quite a while, a lot longer than you would think. You want to check for 60 seconds. There's a number of reasons for that. One, it's really easy when you're excited to actually push too hard and actually not feel the pulse at all. But also, depending on how long they've been buried, their pulse might be really slow, 10 times a minute. So that's why you want to check for 60 seconds, and actually 60 seconds will fly by anyway. Bleeding, major bleeding. It's actually not a huge problem in avalanche victims, but I'm just going to mention it anyway because it has happened a few times. You want to check for any sort of open wound that's oozing blood or spurting blood, especially underneath the clothing. It can, depending on the severity of bleeding, it can cause death super quick. So if you see any bleeding, it's a good idea to stop it as soon as possible. It can actually also worsen hypothermia. So, as I said, it's super rare in avalanche victims, but it does happen. Disability, neck and spine. This picture right here shows what's called the cervical spine. It's the neck. And this is the area right here that's most prone to get injured during an avalanche. It's also where kind of a lot of your nerves come down for your breathing, for the muscles of your breathing, and your legs and neck, or in your legs and arms. So it's a good idea to try to protect the cervical spine as much as possible. Once you've found the victim and gotten their airway cleared, and it's a good idea to try to, again, take another deep breath and think about things. Try to move them slowly. Try to make it so that any extreme movements to the head or neck are sort of eliminated or limited as much as possible. It's a good idea to maybe tell the victim if they're conscious, like don't move your neck, really just kind of relax from here, and again, handle them pretty gently. There's a lot of studies now that show that if you actually have a head and neck injury, or a neck injury, and you're conscious, you'll do a pretty good job yourself protecting it if you're conscious. If you're unconscious, obviously you can't protect your own spine at that point. But if they're conscious, just tell them to keep it aligned, whatever is ever more comfortable. Just like you break an arm, right? You're not going to move your arm around if it's broken. If you have a neck injury, you're not going to move your neck around. Exposure. Keep the victim warm. Here's a really good picture of a companion rescue, and one of the first things they did, if you see right here, they're holding cervical spine. They're making it so that the victim's head, the neck is protected. But this guy right here is actually throwing on a puppy to protect him, to keep him warm and to protect him from wind. Basically, you should treat every victim for hypothermia right off the bat. You want to reduce the heat loss as much as possible. You want to protect them from wind to get rid of a lot of that ability to lose heat. You want to make sure that the torso especially stays warm. If they're conscious and they're able to swallow, give them some high-calorie food, drink, do whatever you have in your pack. Shivering, which is our body's natural reaction to hypothermia, is actually a really good way to stay warm, but it takes a lot of sugar, a lot of calories to do it. And so when your body is hypothermic and you're shivering and then you start to stop shivering, that's a problem. And one of the reasons that you start to stop shivering is you start to lose calories in your body. So it's a good idea if they're conscious and awake and they're complaining of being cold, if they can, give them something to eat, high-calorie food or drink. Most people carry that anyway, skiing. Somebody once told me, calories is to warmth as wood is to fire. Again, only if conscious and alert. Don't try to shove, if somebody's unconscious, don't try to shove food down their throat, right? That might cause a lot more problems than solve. All right, so let's say that somebody is buried less than 60 minutes and there's no signs of life. What are no signs of life? Airway. The airway is blocked. Unblock the airway if it's visibly blocked. Breathing. The victim's not breathing. Circulation. The victim has no pulse. You check for your pulse for 60 seconds and you don't feel one. You basically want to take this and you want to clear the airway as soon as possible. You want to give a few rescue breaths. And you're going to want to start CPR as soon as possible. Who's taken a CPR class in the past 10 years, right? So the prevailing wisdom, right, is start chest compressions, then you worry about airway, then you worry about breathing. But with an avalanche victim, the reason their heart has stopped probably isn't due to any sort of 20 years of eating cheeseburgers and bad life decisions. It's due to the fact that they've stopped breathing. So if you can give them a few rescue breaths, you can actually help kind of get them conscious and get them breathing. It actually does work. There have been people that have been buried. They start a companion rescue. They're not breathing. They didn't feel a pulse. They may or may not have had one, but sometimes it's hard to feel a pulse when your heart doesn't beat very fast or very strong. And they've given a couple really good rescue breaths, and the person kind of comes back. And slowly they'll come back and regain consciousness. This is the jaw thrust right here. So with the jaw thrust, this is the main way that you want to try to give the victim rescue breaths. It only works if you have two people to do this. One person will put their thumbs on either side of their mouth, and with their fingers, they're actually pulling the jaw forward. There's this angle of your jaw right here, and they're pulling it forward to help get the tongue out of the way. And this is really good if you're worried about a neck or spine injury. This way right here, this is called the head tilt chin lift. This is the way that you open up an airway if you're not worried about a spine injury. However, if it's only you and the person is not breathing, I would probably do this, because not breathing is a kind of a bigger issue than a potential spine injury. That makes sense? So if they're not breathing, you're going to try to clear away the air or the airway of any snow debris that you see. Open up the airway, look, get anything out that you see. Again, a little bit different than CPR that they teach you, right? They teach you not to really put your hand in somebody's mouth. But I would assume that if you're skiing with somebody, it's probably your partner that you've known forever, or your significant other, or whatever. You probably don't care. You want them to be alive. And, you're going to give rescue breaths. So to give rescue breaths, you're going to want to pinch the nose, form a seal around their mouth with your mouth, and breathe in for 2 seconds. And then you're going to remove your mouth from the victim's mouth, wait 5 seconds, and then repeat. You're going to do that 2 or 3 times. The victim at that point does not become conscious. You're going to start CPR or chest compressions. And this is not really a replacement for a really good CPR class or another class that maybe just teaches hands-only CPR. That's a big push that fire departments are doing right now. They're not really teaching an hour-long CPR class. They're teaching just do chest compressions. So if you haven't taken one of those classes, I highly suggest it. So this is for somebody that does not have a pulse after doing a pulse check for 60 seconds, and they're not breathing. Again, check the mouth, remove any obstructions like snow or debris, and you're going to want to perform quality chest compressions. You're going to put your hands over the sternum, between the nipples, and you're going to push down at a rate of 100 to 120 compressions per minute. The classic song is Staying Alive. It's like That's the beat that you want to push down to. You want to push down 2 inches or 1/3 the chest depth. And you're going to do that 30 times, and then you're going to get 2 breaths. 30 times, 2 breaths. And then you're going to check for a pulse every 2 minutes. So if you were to do 30 chest compressions, like 1, 2, 3, 4, 5, and 29, and 30, 2 breaths, you're going to do that about 5 times before you check for a pulse to see if what you're doing is working. Yeah.
Do you want to like unzip all their coats and get down to like their base layer or bare chest?
That's a good question. And I would say that would probably be for the best, but you don't have to like strip their whole shirt off. Because at that point you're not really worried about hypothermia. And there's some debate. A long time ago during CPR, what we would do in the fire department, we actually cooled the victim down. We used to cool people down. There's a lot of debate whether that actually works anymore. Some people still do it, some people don't. I'm not a doctor, so I don't. They tell us not to cool them anymore, so we don't cool them anymore. But I think that would probably be preferable, and then worry about hypothermia if the CPR works. That's a good question. Again, if you can, it's a good idea to switch compressors every 2 minutes. So when you do a pulse check, just hurry up and switch compressors. Doing chest compressions is really difficult. If you've ever taken a CPR class where you actually had to do it, 2 minutes is about the max that anybody can do, whether you're like a big burly like firefighter that looks like a linebacker or a tiny nurse. 2 minutes is the max that anybody does quality chest compressions. So terminating resuscitation efforts. So it's like the hardest decision you may have to make, right? But after a certain amount of time, what you're doing isn't working. It might be a good idea to stop, especially if you're in the mountains. Like, it's one thing if you're here in the city, but if you're in the mountains, that's a whole different ball of wax.
On the slide a couple back, it said CPR 30 minutes. Did that mean in the first 30 minutes?
Let's see, what did it say?
Sorry, I'm like right there. Right under no signs of life, it says CPR 30 minutes. Does that mean in the first 30 minutes?
So yeah, I was about to go through that, right?
Sorry.
No, that's great. That's a great question. So the question is like, what does that 30 minutes mean? So you're going to want to basically do CPR for a maximum of 30 minutes. That's what that means. That's perfect. That's awesome. So CPR, if you're doing the 30 compressions, 2 breaths, and you do that for 30 minutes, and the person isn't coming around, they're looking like they're not alive, they're not conscious, nothing is changing. 30 minutes is the max amount of time that really that'll start to work. After 30 minutes, the chance of survival, if your heart is stopped, is pretty darn low, unless somebody else comes. Typically, when we do CPR in the urban environment, we do it for 40 minutes, but we also have monitors, we're giving drugs, we have advanced airways. If you're just doing a CPR where you're pushing down the chest and giving rescue breaths, if it hasn't worked in 30 minutes, it's not going to work, unfortunately. Another reason that you'd want to stop doing CPR is if the scene's no longer safe, if for whatever reason the scene becomes unsafe for you or your partner. And this can happen. Let's say you're doing an evening tour and it's just getting cold and your partner and you are in danger of getting hypothermic yourself. Then it might be a good idea to stop. If you can't physically perform CPR anymore, it's hard work. CPR is hard work. I can only do CPR for maybe 5 or 10 minutes before I start to get really tired and exhausted. Obviously, maybe if it was somebody I loved, I would probably just do it for as long as possible. But it's hard work. Or advanced medical professionals take over if you're doing CPR. And then somebody comes, like search and rescue, life flight, Wasatch Backcountry Rescue. They come and they take over. Then it's kind of their decision at that point. There are a few times that you might want to consider prolonging CPR. Consider prolonging CPR if the victim's been buried for longer than 60 minutes and they had a clear airway when rescued. So if the airway is clear, if they have a big, let's say there's no sign of ice mass formation, they didn't have anything obstructing their airway, or they had a really big air pocket, and it's been an hour since the last time that anybody saw them, and you get them out and you're doing CPR, at that point, probably what happened was the person that was in the avalanche actually died of hypothermia, or they could have died, or they could have, their heart could have stopped within the past minute or two of you getting them out. And so hypothermic victims can actually be rescued for quite a long time after their heart stops and they stop breathing. One of the most famous examples happened here in Utah in the 70s. A little girl fell up in Bell's Canyon, right below Bell's Canyon, into that river, and they got swept down into Cottonwood Heights, Sandy, wherever that river goes. And they found her an hour later, or maybe it was like hours later. It's been a while since I heard this, but and then they flew her. They flew her to primaries, which had just opened, and they were able to revive her after hours of not breathing because she was in this really cold river. It was something like March or April, so it was like spring runoff. So hypothermic victims can survive for prolonged cardiac arrest, which means your heart stopped. So let's say that you have a victim that's been buried for longer than 60 minutes, and they have signs of life. So they've been buried 60 minutes, they're breathing. The big thing is, their airway's not blocked, they're breathing. When you check somebody's breathing after they've been buried for a long time, especially if their airway is cleared, check for 60 seconds. Before, it's not really in there, but before, when you're checking for breathing up here, you check for about 10 seconds. But here you should check for 60 seconds. And the reason being is that somebody, if they've been buried for that long, might be breathing at a rate that's maybe 1 or 2 breaths a minute. And so you don't want to miss that. Circulation, again, check the pulse for 60 seconds. You may only feel once, twice, 10 times in that 60 seconds. It might be super slow, like you're used to like maybe 60 to 100 times a minute when you're just feeling your pulse here. It might be like pulse, it might be that slow or slower. So check for quite a while. If there are signs of life after prolonged burial, there's a good chance that the avalanche victim might be suffering from severe hypothermia. Severe hypothermia can affect your heart. It makes your heart very unhappy to be moved around, to say the least. And any sort of major movements, jostling, can anger your heart and actually put it in a rhythm that's not sustainable for life. It might be beating, but it might be quivering, or it might stop beating altogether. So if they're alive and they have severe hypothermia, just slow down and be gentle. You handle them very gently as possible, very gingerly. They've been born kids. At that point, if somebody has severe hypothermia, they're probably not going to be conscious. If they are, they might want to do things that, they might act strangely or abnormally. Just have them lie down, keep them relaxed, avoid moving them as much as possible, get them insulated, monitor the pulse and breathing constantly, and get help. There's no way that you're going to be able to get this person out of whatever environment they're in without help. They're going to need a helicopter or a snowmobile or a team to get them out. You're going to want to monitor their pulse and breathing while that help arrives, because they could go into cardiac arrest. Their heart could stop at any second. And if that happens, You're just gonna have to perform CPR. A lot of times, people in severe or extreme hypothermia, if you start CPR on them, it can actually kick their heart back into a normal rhythm and beating normal. So if somebody's buried greater than 60 minutes and there's no signs of life, meaning they have a blocked airway, you're going to check the airway. If the airway is cleared, you should perform CPR. If it's blocked, they have a pulse and they're not breathing, they should. It's not a. They may or may not. CPR may or may not work. You could perform CPR, but it most likely won't work. And so, the recommendation is that you shouldn't perform CPR. However, there are cases where they've brought mainly children out of. There was an avalanche in Europe. I can't remember when, but there was a child that was buried, and it was kind of a weird circumstance. But they were buried under the snow for hours. But they were also in. I can't remember if it was a building or a car. But they had a pretty big air pocket. But they weren't. They didn't have a blocked airway, and so they were able to do CPR and get them back. If they have a blocked airway, and it's been longer than 60 minutes, they probably succumbed from asphyxiation long before you got to them. Again, you're going to check for pulse and breathing for 60 seconds. Basically, this says start the CPR if they have a patent airway. If they don't, you can stop CPR. If they do, perform CPR. Withholding the resuscitation efforts. So this is kind of all this is talking about. You find them. Let's say you find that you're the victim of an avalanche. If there's obvious death due to a traumatic injury, you probably shouldn't just go in and start CPR. So what is that? Sorry for being graphic, but like brain matter is visible, lots of blood, obvious head or neck injury, basically any injury that is not, sustainable for long. If the burial time is greater than 60 minutes, they have a blocked airway, and you feel their core, like their chest and torso, and it is super cold, they probably died a long time ago. They most likely succumb from asphyxiation. Or you don't have to perform CPR on somebody whose chest is so stiff due to hypothermia that you can't physically do CPR because the torso is frozen. And they're buried for longer than 60 minutes. Usually this doesn't happen if you're buried for 15 minutes. It's usually that longer time. So documentation. It's really important to document everything and to get an idea of what's going on for the rescuers and for the doctors and for continued care down the road. So you want to try to figure out when the avalanche was. Everybody has a watch or a phone or something. It happened at 2:25. How long they were buried. The condition of the airway. Did you have to take away snow and ice and debris? Was there an air pocket? Was there an ice mask? The air pocket thing and the ice mask thing are actually really hard. When I asked one of the docs about this, because it says, this is the back of the avalanche booking algorithm. It says air pocket, yes or no. I asked one of the docs, like, how many times has somebody said, like, there's an obvious air pocket? Most of the time, you're going to obliterate any air pocket when you unbury, right? You're going to, if there was a little air pocket right here, and you're digging them out, you won't ever see it. Right? So, but just note to see if you have any sort of thing blocking the airway, any snow or debris. Did you perform CPR before rescuers got there, or before they sort of came to? And if you did, for how long? Would you note any trauma? Is their arm broken? Is their leg broken? Did you notice any weird rib things going on? And maybe any treatments that you gave them. All this stuff is important for rescuers and doctors to know. So first aid kit items. I carry a standard first aid kit, has Band-Aids, and, Band-Aids, and ace bandages, and things like that. I also carry a SAM splint. This is probably one, I have a lot of SAM splints. I carry a SAM splint in my climbing bag, in my mountain biking bag. I carry one in my ski bag. This is a 36-inch SAM splint. You can fix a lot of problems with the 36-inch SAM splints as far as broken bones, broken arms, broken anything. So I always carry one of these. They don't weigh anything, and they fold, and you forget about them. I usually put mine kind of wherever. It doesn't matter where you put it. Just have them. I also carry a Mylar blanket.
But can you go over real quick how to use that SAM splint, just real briefly?
Yeah, I mean, it's beyond this. It depends on really the bone break, right? So there's like a bone break here, or usually they're only made. I'll use them on 3 different breaks. Lower arm, maybe a tib fib down here, or your ankle, or you can use them for your neck. But the nice thing about the SAM splints, it kind of shows you how to use them, but it's kind of beyond. To really know how to use one, you have to take like a course and get hands-on on it, I would say. You can buy them, and there's a lot of maybe get online and kind of play with them. I could show you how to do it, but then you'll probably forget because it's just me showing you, and then you haven't played with it. I'm a big believer of hands-on. I do carry a Mylar blanket. These things are $3. They don't weigh anything. I carry these everywhere with me because hypothermia is a big problem. You can wrap somebody up, and it prevents wind. I like the big orange ones because then you can see them from space usually, right? Which is nice if you're trying to be rescued by a helicopter. Being able to see the big orange thing. Also, like if I'm not going to use one of these for hypothermia, I'm going to spread it out really big somewhere with a clear view of the sky. And if I have 911 on the line, I can say, look for the giant orange blanket. And it might help them kind of spot you from the air. I also carry, a little emergency bivvy. I carry one of these with me skiing. There's even smaller ones now. This one's by Soul. That I think means survive outdoor or something. This is just a nice little bivvy sack. It doesn't weigh anything, and I can throw somebody in there if I need to, if they're injured and I'm waiting to get them out. This will help prevent hypothermia as well. Hemostatic gauze and Israeli battle dressings I carry. These are mainly for bleeding prevention. As I said, I just have one in my first aid kit usually all the time, but these are really great at stopping bleeding. High calorie food, like this is little Scratch Labs, throw in your water, goo, honey from wherever. I also carry a lighter. The lighters that are electric, they look like this, and they don't have a flint or steel, are usually a little bit better in wet environments. They don't, the flint and steel ones, like the Bics, when they get wet, they stop working. But these are actually kind of hard to find. So if you're at a convenience store, whenever you get gas, I look for these, and I usually buy 1 or 2 of them because they're impossible to find.
How do those do in the cold?
They work pretty well. If they don't work, the reason these don't work in the cold is because the gas inside is colder than the environment around it. So you can't actually produce a vapor. So if you just put it in your hand, warm up the liquid so it can become a gas, then they work pretty well. So these things are awesome. Actually, the Avalanche Center told me to get electric ones, and so I was like, oh, it's a smart idea. And again, there's a bunch of different styles of them. So you've taken this, where do you go from here? If you haven't taken an avalanche course, take an avalanche course. Like take an ARI course, or American Avalanche Institute, or UAC, Utah Avalanche Center has the Backcountry 101, 102 courses. Anything that kind of teaches you how to spot an avalanche, how to stay out of the terrain, is going to be good. More education is never a bad thing. Take a CPR course if you haven't taken a CPR course or it's been a while. Take a CPR course. The gold standard is American Heart Association, American Red Cross. There's hands-only CPR courses that happen all the time. If you just look at your local fire department, these hands-only CPR are great for people that don't really want to spend 3-4 hours learning how to do a CPR course that a medical professional will take. These hands-only CPR courses are awesome. And I think, just as an aside, you should just know how to do CPR in the urban environment too, because if you start chest compressions on somebody that's heart stopped, you actually increase their chance of survival by quite a bit. You can also take a first aid course. You know, the wilderness first aid is like a 16-hour course. The wilderness first responder is a 80-hour course. Those are sort of the next steps. The Mountain Medical Academy, we're actually working on taking this and turning it into a course where you actually have to find a victim out in the real life and then perform various things on them. So hopefully that happens this winter. You can check our website or our Instagram page. But we're hard at work with our docs doing that. So in conclusion, the most important factor is burial time for victim survival. Trauma can cause death instantly or slowly, but really asphyxiation, it will happen within the first 20 minutes. The victim's going to die of asphyxiation within 20 minutes. If they haven't died within that 20 minutes, then hypothermia becomes a concern, and that becomes a big concern after 60 minutes. Asphyxiation is still the #1 cause of death worldwide. Some places, it's worldwide. In some places it's 68% of the victims died by asphyxiation. In some places it's 80% of the victims, but asphyxiation is still the #1 cause of death. Your partners can affect you, or your partners can affect the outcome greater than anybody else. It's up to you, as I said before. Prevention is the best way, obviously, to avoid death by an avalanche. It's because if you get buried completely, it's still a flip of the coin whether you survive or not worldwide. So stay out of avalanche terrain, wear a helmet, consider getting a bag, carry the rescue equipment. A couple people I'd like to thank. These two doctors right here are really like the avalanche gurus. They know a lot of this stuff. I worked with them for about 4 or 5 months to get this presentation as robust as possible and medically accurate as possible. Dr. Colin Grissom works at Intermountain Medical Center. Dr. Scott McIntosh works at the University of Utah. And then Dr. Albert Wheeler, who works in St. John's and Jackson Hole, and then Dr. Jeff Lane, also at the University of Utah. Also, like the Avalanche Center, I kind of ran this through them last March, and they gave me a lot of really helpful suggestions. Backcountry Zero for letting me use the Avalanche victim algorithm. Schemo, obviously, for letting us use the space. You guys have any questions for me?
We have one on the live stream I can look at real quick.
Someone says, thoughts on new mask as preferred mask airway tool in winter environment, optional and recreational environment, but best tool if you're going to bring a pocket mask.
Oh, like a BVM. Oh, yeah. So, I'm like, mask. I was trying to figure out what that. So, what I assume that they're referring to is a mask that goes around the face and seals. And usually they all have like one-way valves, so that whatever wet stuff is inside the person that you're giving rescue breaths to doesn't get into your wet stuff, right? So you want to keep that separation. That's a really good question. So I would never, ever, ever in my entire life do mouth-to-mouth resuscitation on somebody I don't know. That's just like flat out never, especially at work, right? As a paramedic. But I don't really carry pocket masks with me. The thought is that if I'm skiing with somebody, it's probably somebody I know and care about, like my wife or my friends. I probably won't have an issue myself giving somebody mouth-to-mouth, like rescue breaths mouth-to-mouth on somebody that I know. That being said, there are little pocket masks. They're like little, they fold into the size of a keychain. People put them on their keychains. They have a little one-way valve. You put it on, and it's just a barrier for you. if you don't know how to work a pocket mask, a mask that goes around right here, they actually don't work very well if you don't know how to use them. In fact, medical professionals still have a hard time using them because everybody's face is a little different, and if you don't get a 100% perfect seal around the mouth and nose, when you breathe in, the air is just going to go out the side and not in. Does that make sense? So, and the other thing about the mask, the mask barriers or the pocket masks, there's a bunch of different names for them. Often you have the same problem, is they don't actually create a really nice seal. So I'm not talking about, you know, I will say this, if I'm performing CPR on somebody, so I'll give somebody rescue breaths initially, you know, the 5 rescue breaths when we unbury them. It's really up to you whether you want to then, as you're performing CPR, give rescue breaths. It can be kind of gnarly, stuff can come up, vomit or whatnot, and you probably don't want to touch that. So, you know, I'll leave that up to you. It's hard to say. I probably wouldn't for myself unless it's somebody I really loved. But even then.
The pocket masks are hard because you don't have an idea of whether or not anything's actually going into them. So if you're just blowing on a mask and it's all going around the side, it's hard to tell that. Whereas unfortunately, if you're mouth to mouth with someone, you know whether or not that air is going into them. So
this is Jill. She's my wife. She's also on the she's an ICU nurse for like the past 10 years. And she's on the board of directors of the nonprofit. She knows a lot. She probably knows more than me. So yeah, there's a lot of problems with the pocket masks.
but if it will make you give someone mouth to mouth, then by all means put one in your pocket and go for it. If that's like what you need to make the plunge, then go for it. It won't hurt you to carry it.
Yeah, that's a great answer. The pocket mask is hard. I don't carry one. I carry a lot of things in my car and when I'm skiing and especially rock climbing or mountain biking. I choose for myself not to carry one. It's mainly because they're big and bulky. You know, they're like half the size of a first aid. If you've ever seen a pocket mask, they're huge. You know, maybe you can carry one in your car, but carrying one in the backcountry, that's a hard decision. Any other questions, comments, thoughts, concerns, jokes, dancing? Push the chairs up.
Do you have any tips? Like, so you had it all laid out, like 2 minutes, 30 minutes, 60 minutes.
Yeah.
But when like something like that's going on, like concept of time shows up. Do you have like any tips on like how to actually keep track of minutes?
Yeah, that's a really good question. So the question is what's the best way to keep track of time when all this is going on, right? So if you wear a watch, a lot of us, and I mean, you all like people that are ski mowers or whatever are super concerned about their heart rate, right? They probably, that's like the one thing they care about the most, right? They're like, oh, I'm getting into my zone 4, I should probably calm down a little bit. If you see somebody go down in an avalanche, if it's your buddy, and obviously, you know, use all those things that you learned in Navy level 1 course, right? Don't ski the same slope at the same time if you're worried about an avalanche, things like that. But if your buddy goes down, it should be like the first thing you think to yourself, what time is it? Like look at your watch, like after they stop, take that big deep breath, be like, you know, getting your avalanche beacon out. Don't go into a situation, I mean, it's gonna be excited, right? You're gonna be excited. Try to take a big deep breath, take a beat. Don't get wrapped around the axles too much. Get your transceiver out and maybe look at your watch. And that probably takes, if you maybe incorporate that into your practice, like as far as like, I'm gonna do a beacon drill today. I'm gonna bury a beacon, we're gonna find it. Maybe incorporate that. Like look at your watch, if you don't carry a watch, I don't carry a watch. Look at your cell phone. If somebody's gonna call 911, 911 will know every time. Like, you know, they keep a timestamp to the second.
If you're starting a rescue effort, sometimes if you have a cell phone, open it up, open up your timer and just start.
Oh, yeah.
It will immediately start timing, like, okay, it's been 5 minutes, because it's hard in the moment, especially when your adrenaline's running and you're checking a pulse and it's for sure been 60 seconds or it's been 5.
The other thing that I do is I have a metronome app, and when I teach CPR, I tell people to download a metronome app. If you don't know what a metronome is, it's a thing that keeps time. I once said, somebody put a metronome app, and they're like, what the hell's a metronome? It's like, ooh, maybe I'm old, I don't know, but it's a thing. You can get a cheap metronome app. If they're free, I put one on my phone, and I put it to 110. That's 110 clicks a minute. And that's what I do CPR to if I don't have anything else. So I'll pull that phone out, I'll click it, and I'll click, 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 and that's what I'm pushing to. The timer is a great idea. I mean, everybody has a phone or an iWatch or a heart rate monitor or whatever. If you click that start timer, but you're right. I mean, time becomes compressed or not in these situations for sure. The big thing is that if you're going to perform a rescue on somebody, if you see them go down, and you're super quick with your beacon, and you start to do the probe, you'll probably start shoveling them out within the first 20 minutes. I would probably guess. 20 minutes is, if you're on the ball and you know what's going on, it's pretty easy to find somebody. The more difficult part would be multi-victim rescues. You find one person, you unbury them, figure out what's going on. By the time you get to the last one, if there's more than 1 or 2 or 3, it might have been longer than 20 minutes, right? So that's why the algorithm that they use is less than 60 minutes or greater than 60 minutes. Because the thought is that you can get a lot of people out in 60 minutes, and if it's after greater than 60 minutes, you're probably looking more at the time frame of an organized search and rescue. And it probably, unless you're can't really think of a lot of places in the Wasatch where it's going to take you see an avalanche, and it's going to take you 60 minutes to find the person. Now, if their beacon doesn't work, your beacon doesn't work, it's not on, the batteries aren't charged, whatever, then it might take a while. But then you're doing like probe lines, things like that. That's the greater than 60 minutes for that. And so that's why a lot of this stuff, it's good to do those checks. Check your airbag if you have one, check your beacon, make sure your probe's not broken. It's probably not broken. A lot of times, especially at the beginning of the year, I replace my batteries at the beginning of every year. That's just my practice. Some people will turn their beacon on and they'll see that it has full bars. Those batteries have been in for like 5 seasons because they never, you don't use it very often. But I always just, what's 3 AAAs? They cost what, $8, $6, whatever. And that's for my peace of mind to know that it's actually working. So that's just, again, my practice. Any other questions?
Do you know if there's any statistics out there for carrying a beacon? Being able to start the search and rescue the second it happens as opposed to, getting down and getting yourself square and calling out.
Are people carrying a beacon, or how long it takes to perform a beacon?
Yeah, if you push the SOS right after the avalanche happens versus
for like are you talking about an avalanche transceiver or a personal locator beacon?
an actual SOS beacon for a Garmin inReach or.
So I don't know that. That's maybe I can look that up. I'll see. It really, I think, would be dependent on the system that you're in. So I'm going to say Europe probably has the best, most robust wilderness search and rescue system in the entire world. Those guys, by the time you call 911 or do a personal locator beacon, I mean, they have doctors on helicopters that are just good to go, and they have guides they're on the ball, and we're not to that level, but we're pretty good in the Wasatch still. I think with the Garmin's is the one I can think of off the top of my head. It goes up into a satellite, it hits their dispatch center, then has to call whatever dispatch center is closest to that person, you, and then that dispatch center has to, contact whoever. So if it's in the winter and it's an avalanche situation, or it could be a potential avalanche situation, you're gonna call search and rescue. Search and rescue is gonna contact AirMed, Life Flight, Wasatch Backcountry Rescue. So it might be a lot, right? So it's a lot. That's why I'm saying it's a lot of the chance of somebody surviving is greater if you perform the rescue than asking somebody else. Now,
If you have one though, and you get it, and
Yeah.
you need help, your partner's buried, that is a great way to get 911 like activated.
yeah, I will say there's also a lot of debate as within the avalanche community and the avalanche rescue community as far as this medical stuff is when to call 911. On the one hand, it's you call 911 right away to get rescue coming as soon as possible. But on the other hand, if it's just you, that's time spent that you could be using to rescue somebody, right? So because it's so open, I didn't really discuss it because I don't have a clear answer for when you should do it. And there are some places in the Wasatch, and we're pretty urban, right? We're front country. A lot of places you can't get cell phone reception. I can't get cell phone reception on the pipeline trail in Mill Creek, right? And it's literally 12 minutes from my house, right? So go figure. So, but if you need help, if you think you're going to need help, get it going as soon as possible because it's going to take a second. By a second, I mean like an hour. It's not going to be instantaneous, unfortunately. They do pretty good, but it takes a while to mobilize the cavalry. But yeah, if you have one of those, man, I would just start it right off the bat. If I saw somebody go down in an avalanche, I'd probably start it right off the bat, or at least when I got to the person. But I don't know. Any other questions?
Those like 60 seconds to check the circulation, 60 seconds to check if they're breathing. Are you not wasting like 2 minutes
So do it at the same time.
that you could do CPR?
So yeah, I would do it at the same time. You can sit and listen. And so I'm also, when I'm checking, and this is something I didn't mention, is that I'm actually looking at the chest. So I'm listening for breaths, and I'm trying to feel for it. I'm looking at the chest, and then I'm actually feeling for a pulse at the exact same time. That's the way I do it. That's the way I do it at work. I'm doing that, and somebody's throwing patches on their chest at the same time. But we have like 7 people. Excuse me. We have 5 people. 1 person talking to family, but the other 4 all are trained professionals that know what they're doing. Right. So
If you start compressions on somebody and they're hypothermic and they've been buried for 60 minutes and they have a heartbeat of 20 beats per minute and you miss that, you may cause them to go into a cardiac arrest.
Yeah.
So it's taking that moment because that minute hits hard, but that minute gives you the time to actually check and make sure you're actually checking for that. It's a lot of people when they're checking for a pulse because they literally just throw their fingers, I don't feel a pulse, and they'll start CPR. With somebody who's hypothermic, because they have to be handled gently, you don't want to just be like rushing in the pound on their chest if they actually have a heartbeat. You want to let them maintain that heartbeat and handle them so carefully. In the urban environment, people have CPR started on them all the time, and they have a pulse. So,
yeah, we do. We get on people, and we teach people. We actually don't even teach people to check for pulse. If you take one of the hands only CPR, we don't tell you to check for a pulse. There was a study that came out by a doctor out of the U who's the king of CPR. He knows more about CPR than probably most people in this country. He did a study and it showed that most people don't do a very good job checking for a pulse. And so based on that study, he doesn't even tell people, lay people to check for a pulse. He's like, go right into it. You'll know immediately if they're if you're starting CPR on someone and they're unconscious and they become conscious, great. You either fix them or they didn't need it, but whatever.
but just because you're working with cold, you have to
Hypothermic victims are a little different. I didn't have this person, but somebody on another crew of mine took care of a hypothermic victim, and just the bumps in the ambulance going to the hospital caused their heart to go into a rhythm, and then they hurried up and did CPR, and it popped it out of it. They're pretty fragile. severely hypothermic people their hearts are unhappy, to say the least. And you can think about it, if you've ever been really cold, like say your arm or leg has been super cold and you bump it, right? It hurts like the dickens, right? Like it doesn't feel good. And you're like, man, why did that didn't hardly hit myself? Or you like stub your cold toe. God, that shouldn't have hurt. Your heart is a muscle and it doesn't like to be agitated when it's cold. And that's usually severely hypothermic people. It's when the core around their heart is super cold.
So I think when I last did my woofer research through Knowles WLI, this was going to be like 3 years ago now, but they were saying don't initiate CPR on a hypothermic patient, but if someone has started, then you need to continue it. Is that fitting into all of this?
If somebody doesn't have a heartbeat and you're checking for that 60 seconds, the hard thing is with that is, let's say you check for 60 seconds, you don't feel a pulse. I probably don't have the training myself to know whether that person actually has a heartbeat or not.
Right.
And it could be detrimental to them if you don't start CPR. Because if their heart's not beating, then blood's not flowing to the important vital organs, not just the brain, but some of the vital organs, your kidneys and liver. If your heart's not pumping, then that's a problem. And so if you feel for that check and it's like, I don't feel a pulse and it's been 60 seconds, I'm just going to start CPR. Because that's probably more important than being like, well, they're hypothermic. Maybe they have a pulse, but maybe not. But if they're so hypothermic that you're checking the pulse and you don't feel one, and they're only beating once every 60 seconds, that's not very sustainable either. Right. So I would probably, if it were me, I'd probably start CPR.
Physicians of Backcountry Zero would start CPR on a hypothermic victim if it's been greater than 60 minutes. Even though they have a clear airway, start your CPR.
Yeah, for sure.
That was based off of their research.
Yeah, and like those physicians are all, I said, the physicians that helped me, Dr. Grissom and Dr. McIntosh, they were both members. Dr. Grissom himself is like a world-renowned expert in avalanche victims. He knows more about it than probably anybody in the world. He goes to Europe and talks to all those guys. And then Dr. McIntosh is he's the head of the Wilderness Medicine Fellowship for the School of Medicine at the U. He's a physician of AirMed. He's one of their associate medical directors. And they were both presidents of what's called the Wilderness Medical Society. They both co-authored papers on hypothermia, and they say do it. So that's good enough for me. That's why I talk to them, because they know all this stuff. So having running by them is really helpful. That's a really good shot. It's a really good question. Anybody else have any questions? Thoughts, comments, jokes? Unfortunately, people, we had a pretty high, last year was one of the highest death rates in avalanches in the country for a long time. Since countrywide, it was I think since 1910. It was the second highest avalanche fatality in Utah. I can't remember, we had 7 last year in Utah. The highest was 8. I can't remember when, in the 90s. And a lot of people are triggering them more. And so it's a good thing to think about all these things for sure. And if you haven't taken an area class or an avalanche Backcountry 101 class, whatever, it's a good idea. It's pretty easy. A lot of people are in the backcountry now, and good or bad, it is what it is. And there's some important lessons to be taken from last year. Is that you can be in an avalanche from a party above you. So it's pretty. I shouldn't say it's scary out there, but it's a good time to know how to be heads up. That's what I would say. Does anyone have any other questions? Well, thanks for coming out. I hope it was worth your time. Thanks.
Thank you.